I'm Denise Brock. I'm the Operations Director for the Global Resource for Advancing Cancer Education, and we're talking today with Catherine Wambugu. Catherine, can you introduce yourself?
Hello, my name is Kathleen Wambugu from Kenya. I'm a cancer survivor, leukemia all. Thank you.
Great. Thank you for doing this. I appreciate it. Let's just jump in and talk about your diagnosis. You were diagnosed at age 22 in 2012. Is that correct? And
yes.
With ALL, acute lymphoblastic leukemia. Can you tell us
Yes.
about that? Tell us how you found out you had ALL, and tell us a little bit about what you were going through before you were diagnosed.
Okay. I was diagnosed in March 2012 after a long illness with anemia since I was a child. So at some point, the doctor saw it was not a normal thing. So he decided to do a test that I later came to understand was biopsy. That was in 2012 March. And after I did the biopsy, I waited for a couple of weeks before I got the results. And that is when the results came, that's when the doctor told me I had leukemia.
Was it, were you given a stage, or was it, what else did he tell you about the leukemia? Just basically.
No. At that moment, he didn't tell me much, because when I was supposed to go for the results, when I went, he requested me to go with someone because I'd gone alone. But me being a bit stubborn, I didn't go with anyone the second time and the third time. And he said, no, I really had to go with someone. So when I didn't go with someone the third time, I think he also was a bit upset because I disobeyed. But he told me the results when I was all alone. And he said, unfortunately, I was having leukemia. So for me, because I was used to the word anemia, I thought it was just advanced anemia. So it didn't hit me hard. I just smiled and I asked the doctor what else was needed. So he didn't explain to me at that time. Sorry, he didn't explain to me at that time what it was.
Okay.
Sorry.
He didn't explain to you at all what it was?
He didn't explain to me what. Yes, but I think he realized I either did not understand or maybe I was not in the right state of mind, because I just looked at him and asked him, when do I still continue doing the transfusion treatment? Is it blood transfusion? Because I was used to it. And then he said, I need treatment urgently. So I just left and he gave me a date to come back.
Okay, so the blood transfusions, you were used to getting those because of the anemia? Is that what you were saying? Okay.
Yes, because my blood was always low. The supplements didn't boost as much. So most of the time I had the transfusions. So on my way going home that day from the hospital, I realized, I remembered the face, the expression I saw on the doctor, which looked shocking when he told me I had leukemia. So when I sat on the bus, I was like, maybe it is something serious. I need to ask someone. So when I got to town, I called my brother and I told him my friend has been diagnosed with leukemia. So what is it? And before I could even explain much, he said, sister, leukemia is a blood cancer and it doesn't get cured. And from there, that is when it hit me what it was. And that is why I now read the document and he looked so disturbed. And after that, I don't know what happened. My world just crashed. I felt them. Yes.
So you didn't know when he told you it was leukemia, did he say the word cancer or did he just say leukemia and you didn't know what that was until you talked with your brother?
he didn't say. Yeah, he didn't mention it was cancer. He just said leukemia.
Okay.
So,
So,
so I think he expected me before he mentioned the name.
right, right. So at
Yeah.
that point, did he tell you you needed to go into chemotherapy, or what was the next step then?
No, when he told me now to go back the next appointment he gave me, I missed it because when I collapsed in town, I was taken to a different hospital where I was in coma for some time. I was confused, so I didn't even tell them what the diagnosis I had had. So they had to do normal tests, and they also diagnosed anemia. So they didn't see the leukemia because they didn't do the biopsy. So when I was out of the shock, I wasn't ready to do any treatment for cancer because now I knew what it was,
Mm-hmm.
and I knew it was dead. So I wasn't ready for any treatment, and I
Right.
just hid it from, yeah. I didn't
Okay.
tell anyone for some time. Yeah.
How long did it go before you ended up getting treatment, or that you told people?
It took me more than 4 months to go back now to the doctor, but when I went back and did some tests, there was no need for treatment. It was too late.
Hmm.
According to the doctor, it was too late for treatment. And that is when he told me I was looking at 6 months from the day he told me
Okay.
I
So
had
when you
leukemia.
so when I have in notes from previous conversations that you were advised to go under chemotherapy, but was that just when he told you, when he diagnosed you, or?
Okay, for the chemotherapy, it was way almost a year after because
Okay.
when he told me about 6 months, then it meant my time was in September. So I could not have taken any treatment. So I just went and waited for death till September.
Gotcha.
When it didn't
Okay.
come and it was October, yeah. So after that, that is when I decided to seek a second opinion. And because now my
Okay.
body was also weak, my mind I wasn't stable. I was told I can only now be managed after I work on my body and I get at least some strength. So I started the chemotherapy the same year, 2012, in around end of November.
Okay.
But they told me it was just to manage. It was not for cure, yeah, just to manage.
Just to manage it.
Yeah,
So how long
yeah.
were you doing chemotherapy then? Did you, because you clearly, they said 6 months, but you clearly lived beyond that. So how long were you doing chemotherapy?
Actually, for me, I think when I started the chemotherapy, it got worse than I felt earlier. For me, it's like it made me even more sicker. And knowing that it's not for treatment, they're just trying to manage it. So even mentally, I didn't embrace it. So after a few sessions, my body like really became weak. And I remember I got up to around 32 kgs, and the doctor said I cannot continue with the chemotherapy. And I
Okay.
was referred to a nutritionist to do diet therapy. As I still waited because even for them at some point they said the chemo would not work,
Okay.
and I also almost gave up on it, and I just hung on to hope, just knowing that I was past September when they said. So yeah. So I actively now got back to chemotherapy the following year, 2013, from around April.
Okay.
And this time there was some improvements at least.
Okay. So
Yeah.
2013. And you, at this point, it was still just management, right? Management of
Yeah.
your
Yeah.
symptoms. Yeah. Yeah.